Welcome back, and thanks for staying with us now. Staying with President Ramaphosa's announcement of a 500 billion rand COVID-19 economic, social and healthcare relief stimulus package. He says funding to mitigate the crisis will be reprioritized from the current budget and local and international sources. The President says National Treasury is already in talks with funders. And now to get reaction on the President's announcement from Senior Research Fellow at the Political Economist at the Trade Collective, Lebohang Pheko. Thank you so much for joining us this morning. Your initial impressions of the President's announcement yesterday?
I think it's good timing, of course. We're well aware that we have to mitigate the balance between our economic health and, of course, our social and physical health. We have taken quite a pounding to the amount of about 14 billion rands per day in the economy, and this is in common with global trends. The entire global economy, of course, has been shrunk through this time. But I think the other thing that's become quite obvious is that ongoing structural deficits and ongoing structural inequalities have only been exacerbated in this time. It's also become very clear that social infrastructure, including healthcare and access to affordable social services, including welfare and grants and business relief at a time such as this, are extremely important. The only comparison that I suppose we have in recent history would be two. One would be the 2008 meltdown, which was not as intense because economic activity did continue, and the bubble was a great extent contained. Countries also had the capacity to evoke their own national policies to ensure that they could put in place mechanisms to protect themselves where possible. But this, of course, because of the lack of basic person power, the people who are available to work the economy, has meant that economies globally have felt this. There's no space of retreat. So in some respects, this was an important and an inevitable conclusion or part of fighting back this pandemic.
Some areas, some people have welcomed the announcement of the sourcing of funding from international sources. Others have reacted with skepticism. What are your thoughts here in terms of approaching the World Bank, the IMF, and the African Development Bank?
I think that the reasons that we've been skeptical historically about approaching the World Bank and the IMF, the International Monetary Fund, have not been resolved. And there is a problem of legitimacy with the IMF, their credibility, especially regarding, firstly, the appropriateness of their policies for African countries and countries in the global south. Yeah. And secondly, of course, that they like recipient countries to own policy conditionalities much more than we have done in the past. But genuine ownership of this can only be derived if the countries themselves have participated in the making of those policies. And that's not usually the case. And it's usually the case, in fact, that policies are imposed in still quite a top-heavy way by the IMF. One cannot, of course, get away from the reality that there's quite a non-democratic, non-participatory process of IMF policy making and the appropriateness of those policies, especially for many of our countries. So ultimatums, which include give us loans or else, and also that, of course, the conditionalities often then have the impact of then retracting on state sovereignty, so in their ability to deploy resources back into social services, back into healthcare. We've been here before many times as countries with structural adjustments back in the 1970s, and many of those systemic concerns and the fundamental, I think, the distrust and the legitimacy of the IMF and the World Bank and their intentions towards countries of the global south have not been resolved. So I think it is a great sadness that we have chosen this particular route, particularly because one of the key demands that many progressive social economists, myself included, have been making globally is that these should not be that the IMF should not be extending loans and extending indebtedness at this time, but rather offer different lines of credit and, in fact, offer grants, because this is an exceptional and extraordinary human and economic moment.
There's also a sense of uneasiness about the allocation and distribution of funds in terms of whether they will reach the intended beneficiaries.
Yeah, I mean, I think we have seen the inherent and really difficult the difficulty of the the SASA and the distributive mechanisms even of the unemployed, the UIF over the last few years, and particularly during this period. People who had, and businesses who had applied for particular key relief have not received it. And this would have been received long after the initial first 21 days of the lockdown have actually been concluded. So I think the basic state mechanisms and state machinery of dispersing these funds has something that the president and the team around him need to address. And if that means ramping up human capacity and personnel in order to do so, I would have seen that as an immediate priority, as well as, I think, cleaning up the reputation of the state in terms of dispensing the resources and deploying the resources to the necessary. I think all of us have been equally horrified and disgusted by the sight of well-paid public officials diverting food parcels from the mouths of people who are already economically marginalized and dispossessed. These are the people who can afford to go to Woolworths and Pick and Pay on any given day. And I think that there has to be a tangible zero tolerance to that. But we also need to see that there are far more mechanisms that are available. And this could mean opening up other offices, opening up public libraries, opening up local government offices, and expanding the reach of the places and the spaces where these financial utilities are made available.
We have a history in the country of the abuse of the SASA system in terms of allocating people who will disperse these funds and how the procurement system is carried out. What would you suggest to government would be the best way in terms of transparency in appointing people who will disperse these funds?
It's incredibly difficult. I think the system has become so broken, unfortunately. And as I say, the reputation management has not been the best over the last few years. I think that there are a few things that one can do, which would be to ensure that there is a much more credible online process, which with particular and important forms of verification. The second would also be to ensure that the people who are then dispensing these funds are themselves also verified, so that there's a trail of a paper trail or a paperless trail, as the case may be, between those who are dispensing and those who are then verified. And I think thirdly, we also need to ensure that in all of this, there are appropriate feedback mechanisms. So we need to triangulate the system in such that between the people who are dispensing and those who are receiving the funding, there are ways to verify that this was actually a legitimate transaction. And then again, this might also mean bringing in private auditing firms and so on to show that there's efficacy in this system, and also involving even the South African Revenue Services, because they have often historically have had the expertise and the historical wherewithal to be able to allocate funds appropriately and to track the funds which are misallocated quite well. And given that this is a all hands on deck situation, a sort of a national state of emergency, international state of economic and health emergency, we have to get very creative and much more cooperative and co-creative about the hows and the what.
What are your thoughts about the extraordinary health budget that was announced? The president making a lot of mention in terms of the funding of personal protective equipment and making sure that healthcare workers work in a safe space.
This is incredibly important, Desiree, because one of the things that we cannot have right now is the frontline workers. I mean, it's one thing to clap for people at 7 p.m., but I think we can't have a situation where the frontline workers who are supposed to be caring for the rest of the community are the ones who are placed at most risk. And I think globally we have seen that in places like the US, in places like the UK, this has actually begun to, especially New York and Chicago, for example, this has begun to actually hamper the effort, because huge amounts of healthcare personnel are not available to do what they're supposed to be doing. Bear in mind, however, that when we speak about healthcare personnel, we shouldn't forget that this does not only include nurses and doctors. This includes anybody who is caring, who is around the healthcare system. And we should really give our respect and similar protection and honor to people who are providing cleaning services, who are providing catering services, who are providing even the maintenance services of public health and health infrastructure, and ensure that in all of these allocations, they are also included, they are also protected.
Well, thank you so much for talking to us this morning.
Very much.
Ms. Lebohang Pheko is the Senior Research Fellow and Political Economist at Trade Collective, unpacking President Ramaphosa's COVID-19 stimulus package on the agenda. Let's take a break.